Good morning and welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha from Roots Community Health Center reporting for the week of May 31st, 2021. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID 19, we are here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Please submit your questions in the comments by direct message or by email to admin@rootsclinic.org. Now, we know that even though the pandemic is worldwide, the effects are very different depending on where you are. So, we're here to give you up to date information about Alameda County, Oakland, and East Oakland in particular. Alameda County now has 88,929 confirmed COVID cases and 1,693 deaths. And one thing that is very relieving is to see that the number of deaths among residents in skilled nursing facilities has really come almost to a screeching halt since getting residents vaccinated. So we are still at 302 deaths within the skilled nursing facilities. That really has not moved. So if we needed any proof that vaccines work, that is a great case study, and I will share more specifics on that in a future briefing. But for now, we're pleased about that progress. With regard to vaccination coming up, it's continuing to come up a little more slowly than before, but we are at 78% of those 16 and up having had one dose, and 64% of those 16 and up being fully vaccinated. And the city of Oakland is just behind this at 76% and 60% respectively. Now, remember, we do have eligibility for those 12 and up. The county dashboard isn't reflecting that just yet. So we'll anticipate that the numbers may actually look lower once they do update it, but that's because we have a bigger eligible population, which is a good thing. And so we'll be able to monitor that going forward. There are still wide disparities in vaccination status, even within Oakland, but we are happy to report that there are now no zip codes in the entire county that are under 50%. And last week there were 4 zip codes that were under 50%. And the lowest remain 94603 and 94621, which are just at or a little bit above 50% of those 16 and up being fully vaccinated. And there are still big disparities in terms of looking at vaccination rates. So if you look at the city of Piedmont, which is one of the wealthiest areas of the county, we are at about 98% with one vaccine and 80% fully vaccinated. So why is that? Why is the most affluent place in the county also the most vaccinated? So I can't say that, like other things, I can't say this is an access issue because I think at this point, everyone has some form of access to the vaccine. And we're seeing more and more availability on weekends, evenings, and mobile access. If you're homebound and you need someone to come out to your home, please go to the county public health department's website and set that up. So basically, everyone at this point has access. The lines are not long, there's multiple sites everywhere. So, as we watch this disparity in the making here, with an area like Piedmont with over 80%, and an area like East Oakland 94603 at 50%, what is going on there? So if you think you know why, please email me at admin@rootsclinic.org because whatever we can do to address this disparity is definitely what we are aiming to do. So today I wanted to talk about those who are immunocompromised because we hear a lot from the community. I'm not sure that I can get the vaccine. I'm not sure that I should get the vaccine because of my immune system. I don't think I have a good immune system. So what should I do? So, first, let's get clear on what we mean about being immunocompromised or having an immune deficiency, because there are a lot of misconceptions out there. There's a lot of people who think they have a bad immune system because they get a cold every year, or they're prone to bronchitis, or because they have diabetes, or they have seizure disorder, or they have asthma. No, this is not what we're talking about. Those are not. Those are not meeting the definition of what we mean when we say immune compromised. All of those things that I mentioned are reasons why you don't want to catch COVID, why you want to protect yourself from COVID, because those are underlying conditions that could make you do worse if you were to catch COVID. But again, this is not what we're talking about when we say immune compromised. We're actually being pretty specific when we say an immune deficiency or immunocompromised. And so, what are we talking about? So, there's two different categories we usually put immune deficiency into: primary and secondary. So, what do we mean by that? So, primary immune deficiency is usually something that's inherited. So, something you're born with where part of your immune system is basically missing. And so you can see that there's a number of these conditions. They're not very common. Some of the more common ones may be chronic granulomatous disease, common variable immunodeficiency, leukocyte adhesion deficiency, X-linked agammaglobulinemia, X-linked lymphoproliferative disease. So these are mouthful, severe combined immunodeficiency. These are, again, not very common. These are inherited, and these are something that this is something that you would have probably known about your whole life and be dealing with. And so these are very specific conditions, and these are primary immune deficiencies. Secondary immunodeficiencies we're a little bit more accustomed to, and these are where they are acquired and where you lose or become deficient in parts of the immune system. And this could be either from a disease or from a treatment. So some examples of secondary immunodeficiency includes HIV infection, some blood cancers that affect B cell production. Remember, B cells is how we make our antibodies. And so this might include certain kinds of blood cancers like lymphomas or leukemias. Also, certain issues with organs like having a spleen that doesn't work, or not having a spleen, or having very severe chronic kidney disease. And the other kind of group of causes of secondary immunodeficiency includes treatments that suppress the immune system. And sometimes we purposely completely suppress the immune system, like in the case of people getting an organ transplant or bone marrow transplant. So we purposely suppress the immune system so that the transplant won't be rejected. But then this also makes you more susceptible to infection. And so this is a form of immune compromise. There are also some medications, like a group of medications called TNF inhibitors, and these suppress the immune system and are used for autoimmune diseases. And then we also have high dose steroids. Now, I'm not talking about a steroid inhaler, I'm not talking about steroid cream, I'm not talking about steroid joint injection. I'm talking about high dose steroids that are given to actually suppress the immune system. And so these are all ways that people become immune compromised. And so, what about immune compromise and COVID? So, people with immunocompromising conditions, including HIV or people who take immunosuppressive medications, seem to be at increased risk for severe COVID-19. And what we mean by that is that there are increased risk of hospitalization, increased risk of intensive care, the need for intensive care, needing a ventilator to help them breathe, or even dying from COVID. And the other thing I want to say about this is that there are now quite a few case studies that are showing that patients with a weakened immune response actually take quite a lot longer to clear novel coronavirus. And so they may have it in their system literally for months as they fight a prolonged case of coronavirus. And as I discussed in the February 2nd People's Health Briefing, these individuals are actually where we believe many of the variants, the mutations, actually come about. And so basically, there's more transmissible varieties like the B117 or other variants of concern, as we've talked about previously, that are more transmissible. They may even be more harmful. And these mutations are actually occurring within individuals with suppressed immune systems. And so it is even more important to consider protection if you are immunosuppressed, because your course of COVID can be prolonged and difficult and much more dangerous and much more severe, but also because they can actually give rise to some of the mutations. And I talked about mutations in a lot of detail, how they happen. And this was one of the main ways that I covered, because in someone with a suppressed immune system, basically the SARS-CoV-2 can be mutating within that person, creating variants, and also that person can remain contagious for much longer. So this becomes obviously a concern for everyone and for the whole world, really, as we see how these outbreaks are continuing to pop up and flare up in different parts of the world, and these variants are arriving right here at Root's own testing site. We have identified the Indian strain. We have identified the strain first identified in South Africa, the UK strain, etc. These things are here. They're in East Oakland. They're in the Bay Area. And we do believe that this is one of the mechanisms that they do come about, COVID. So it's very important that we explore the ways in which we need to protect ourselves if we are immune compromised. So, what about the vaccines? So remember, when we talk about the vaccines, we're talking about two different things: safety and effectiveness. And as I mentioned, when we kind of did a deep dive on the vaccines themselves, there were not enough people with all the different kinds of immune deficiencies in the trials to sort of make absolute determinations about everything about the vaccine, about how it will work and how it will behave in each of these populations, because they tend to be smaller. But it is something that is being monitored quite a bit here. So, with regards to safety, we know that the three approved COVID-19 vaccines are not live vaccines. And I talked about this a lot in detail last week. And so, for that reason, they can be safely administered to immunocompromised people. And so it's worth saying here that there are some live vaccines that cannot be given to people with certain immune deficiencies. But again, the COVID vaccines are not live vaccines, at least not the ones that are approved for use here in the United States. And so the concern here is not for safety. There were also small numbers of people with HIV who were stable on medications in the COVID-19 vaccine clinical trials. And again, no safety concerns came up. There were also people with autoimmune diseases, and there was also no difference between the side effects or any adverse reactions between those with HIV or autoimmune conditions compared to others. And so we have no reason to believe that it will hurt you. Question is, how much will it help? So we know that other vaccines, like the flu vaccine, have been shown to be less effective in people with immunocompromise. And so we basically know that there is a potential for a reduced immune response. And of course, each situation is different, each person is different. Currently, the COVID-19 vaccine is recommended for people with immunocompromise, but it is hard to predict just how good of a response you will mount with the vaccine. So, this is why the recommendation is still to continue to protect yourself from COVID 19, even after the vaccine. I'll talk about that a little bit more in a bit. But bottom line is that the vaccines that we have are incredibly effective, and some immunity is better than none. So even if you don't mount that response that we're seeing with people with a completely intact immune system, there is some mounting of a response. And so there's a number of smaller studies. I'm not going to get into all of the details because I think more information is coming out every day, but also because the bottom line is the same. Whether you get a 50% response or a 60% response, this is better than no response. So some protection can be the difference between life and death. Because remember, this, even if you get a mild case after vaccination, this is just much less likely to cause severe illness. Now, again, in people with immune compromise, where how effective, all of those things are going to be very dependent on what the reason for the immune compromise is. And because, as I reviewed, there's so many different factors, different conditions, different medications. I don't think we're going to end up being able to give a blanket statement that the vaccine is X% effective for each and every one of these conditions for a while. So, in the meantime, the bottom line is that immunocompromised people can, and in most all cases, should receive the COVID-19 vaccination. But there are some considerations regarding timing. And this will be most relevant as it relates to the immunosuppression that I talked about from medication. So, again, not a ton of data here, but based on general best practices that were put forward by ACIP, the Advisory Committee on Immunization Practices, the COVID-19 vaccination series should ideally be completed at least 2 weeks before starting immunosuppressive therapy. And if you can't complete the series, if you can't get both doses of the two-dose vaccines, one is better than none. Again, you may not mount as big of a response as someone else from getting just one. So two is good. But again, this is really going to depend on the individual situation. And your specialist should be the one to make the determination about the timing of your treatment. And so, if treatment can be delayed or should be delayed in order to complete the vaccine series, then that is something that you and your specialist would discuss and figure out. And so, it just really depends on the underlying disease and what the risks are from delaying the treatment versus the risks of an exposure to COVID. And so, if you fall into these categories of primary or secondary immunodeficiency, please do check with your doctor as soon as possible to ensure the best timing for this life saving intervention. And please don't assume that you're not eligible for it. You absolutely have the right to it. You actually are considered prioritized for it. And also, don't automatically assume that you fit into this category. For example, if you have cancer and are in remission, you don't even fall into this category at all. If you are on chemotherapy or radiation, again, this is when you talk to your specialist and make a determination about how to get the best timing so that you will mount the most robust response possible. And so, just a quick word on autoimmune illnesses because these are a little bit different, and it's not so much the autoimmune condition itself that's the concern, it's the treatment. And so, I've talked a little bit about this already. I did mention that people with autoimmune conditions were eligible and were enrolled in the COVID-19 vaccine trials. And again, there was no imbalances in terms of symptoms or adverse reactions in those with autoimmune conditions in the vaccine group versus the placebo group. So this is reassuring. So people with autoimmune conditions may receive any of the approved COVID-19 vaccines and again are considered prioritized. And this is according to the American College of Rheumatology, which is a great resource that rheumatologists have been able to rely on for a number of very specific recommendations about a number of different medications and how they should be timed with respect to the vaccine. So, again, speaking to your specialist is the way to go. The American College of Rheumatology put together a whole host of guidelines for vaccination for those who have rheumatic and autoimmune diseases like rheumatoid arthritis or psoriatic arthritis. And it includes specific guidelines about the timing of medications like cyclophosphamide, which is an intravenous drug, or the drug rituximab, which has been a little bit tricky, and they've had to figure out exactly how many weeks to space from the vaccine. So, again, bottom line, if you have immune deficiency, your chances of doing poorly from COVID-19 itself are increased. So, we really want you protected. Getting the vaccine is not harmful and it should be helpful. It may not be as helpful as if your immune system was functioning tip top, meaning you may not mount as robust of a response, but some is better than none. And as I've discussed on previous briefings, this is a novel coronavirus, meaning is brand new to you. And if your system has never seen it before, you are really rolling the dice if you get exposed and you're not protected. So some protection is better than none. What else can you do? I'm going to suggest two things. And one is a recommendation that is coming from basically everywhere, which is that you should continue taking precautions even after vaccination. So that means continuing with being careful who you're being exposed to, avoiding crowded indoor spaces, continue the masking. And this is for your own protection, because once again, we don't know how robust of a response you've mounted from the vaccine. The second, and I think this is not hard for people with immune compromise because most people who are immune compromised are very careful and have been very careful throughout this pandemic. And I think to take it another step further is to consider trying to build what I'll call a circle of protection. So that means your caregivers, the people that you're around, encourage them for you, if not for themselves, encourage them to get the vaccine because we do not want you exposed to COVID-19, period. So people coming in your midst with COVID, because we don't know the percentage of protection you've gotten from your vaccine, we want to encourage that those people be vaccinated. So build yourself a circle of protection to the extent that you can and continue to protect yourself. And definitely check in with your physician, with your specialist about getting access to this life saving intervention. So until then, we're going to continue with all of our layers of protection, vaccination for those eligible 12 and up, masking and spacing, properly fitted, high filtration mask whenever possible, testing if you get symptoms, and this is whether you are vaccinated or not, isolation and quarantine until you get your results. Also, if you are exposed, get tested in 5 to 8 days. If you are unvaccinated, and isolate until you get your results. Layers of protection indoors include ventilation, so fresh air circulation is our friend. Being outside is even more of our friend. And one thing I want to say here about being outside is that when you're outside, the particles disperse so quickly that we are not worried about aerosol transmission. But hear me on this, we still have to be concerned with the other kinds of transmission. So, droplet transmission is still a thing. So, if you are outside unmasked and you're having a conversation with someone who's this close to you and they spray, and we know some people spray when they talk, well, that lands on your mouth, your eyes, whatever, then you are at risk. So, I say this to say that being outside is definitely protective. We're not worried about the accumulation of COVID in, as we are in indoor spaces with poor ventilation. So ventilation is great, but we're still going to be cautious about not being too close, spraying on one another, sharing drinks, sharing things, and then touching our face, etc. So it's not that all bets are off when you're outside, but it certainly is a major layer of protection because, as we know, aerosol transmission is the one we are most concerned about, and so for that reason, we are also going to avoid crowded indoor spaces. We're going to want to make sure that we have good filtration on our HVAC systems, and we're going to want to continue disinfection and sanitization, especially on our high touch surfaces. This concludes today's People's Health Briefing. Thank you for joining us. Please tune in next Tuesday at 10 to see you then.